Small but unusual changes in elderly loved ones, not just signs of normal aging. We often think that slowness, forgetfulness, or fatigue in older adults is a natural part of aging. However, sometimes these seemingly minor changes are early signs of a deeper shift, possibly an indication that their body is gradually weakening, quietly preparing to withdraw. Some changes may seem insignificant, such as unexplained weight loss, sleeping more than usual, or becoming withdrawn and distant, easily overlooked. But these signs are actually early warnings from the body. In many cases, these signs appear months, even years, before the body enters its final stage. They unfold slowly, quietly, and are easily mistaken for normal aging symptoms. By the time we realize it, it is often too late. Too late to mentally prepare, too late to say a proper goodbye. The issue isn't about panic or pessimism. The goal of recognizing these signs is not to worry, but to understand more about the final journey of life. With understanding, we can care better, prepare more thoughtfully, and create truly precious moments of love. Imagine this. If you notice that your loved one is gradually losing their appetite, no longer interested in activities they once enjoyed, or starting to withdraw from conversations, it's not just simple fatigue. It could be the body trying to tell you something, that their vitality is waning, that they need a different kind of care, gentler, more empathetic, and focused on quality of life, not just prolonging life. Early recognition gives us time to prepare. Preparation not just in medical terms, but also emotionally. It helps us make better decisions. Should we continue aggressive medical interventions, or is it time to focus on peace and comfort for our loved ones? More importantly, early preparation opens up the opportunity to connect more deeply. It's a precious time to hold hands, recall memories, express gratitude, apologize, and share love, things that are often forgotten in the rush of life. In the end, the scariest thing is not death, but not having had the chance to live fully together before saying goodbye. Listen to the changes, even the smallest ones. It's not the end, but a reminder. Be present, love, and be ready. Common signs before an elderly person passes away. Unexplained weight loss. In the journey of caring for elderly loved ones, there are seemingly small signs that carry deep meaning. One of the most notable signs, and often overlooked, is unexplained weight loss. Many people think that weight loss in older adults is normal, sometimes even assuming that losing weight is good. However, in reality, sudden or gradual weight loss without a clear reason can be a signal that the body is entering its final stage. This is not a healthy change, but a warning that the body is gradually shutting down, bit by bit. At this stage, older adults often lose their sense of hunger and no longer find interest in food. They gradually eat less or may even fail to recognize familiar flavors. A diminished sense of taste and smell makes previously loved foods seem bland and meaningless. This isn't just a matter of taste, it's also a biological change deep inside the body where systems start to slow down. Accompanying the reduced appetite is muscle atrophy. The body no longer has enough energy and nutrients to maintain muscle mass. This leads to weakness, difficulty moving, an increased risk of falling, and growing dependency on caregivers. For many, simple actions like getting out of bed can become overwhelming. Many families, upon noticing weight loss in their loved ones, instinctively try to force them to eat. They prepare tastier meals, seek out weight gain supplements, or even use appetite-stimulating medications. However, in the final stages of life, forcing food isn't always the right solution. The important thing is not to get them to eat a few more spoonfuls of porridge, but to ensure they feel comfortable without pressure or discomfort related to eating. Let's look at this issue from another perspective. When the body no longer wants to eat, it's not stubbornness or depression, but a natural shift in the body, a gentle way to prepare for letting go. Trying to reverse this at all costs may cause additional fatigue and even harm the patient physically and emotionally. Instead, caregivers should shift their focus to emotional support and comfort. If they only want a few sips of juice or a spoonful of ice cream, let them enjoy it. Sometimes a meal isn't to nourish, but to bring a little joy, a little comfort in their final days. Understanding and accepting these changes is not surrendering, but a sign of deep love. When we stop forcing and start truly listening, we are giving our loved one the greatest gift: to pass peacefully, to live their final days without pressure or pain, just lightness and love. Prolonged fatigue, when the body is preparing for departure. One of the common signs, yet easily overlooked, in elderly individuals during their final stages of life is prolonged fatigue, a deep exhaustion that rest cannot relieve. If you've seen your loved ones sleep almost all day, only awake for brief periods, or lose interest in activities they once enjoyed, it's likely not just laziness or depression, but a very natural biological stage. The body is shutting down its functions in preparation for the end. Exhaustion without doing anything. You may notice your loved one sleeps all day, then wakes up and says, "I'm so tired." They aren't exerting themselves, not doing any heavy work, yet still feel exhausted. This leaves many caregivers worried or confused. Some think they need to try moving to get better, while others suspect something is wrong. In fact, prolonged fatigue in the elderly is not always a sign of acute illness, but sometimes part of the natural journey toward the end of life. At this stage, the body starts to prioritize energy for the most essential functions, like breathing, circulation, and maintaining body warmth. Activities such as talking for long periods, walking around the house, or even sitting up, all consume more energy than we realize. And their already weakened bodies only have enough strength to maintain the essential functions. Sleeping a lot is not laziness. Sleep during this stage is no longer just regular rest, it is part of the withdrawal process. Your loved one may sleep almost all day, wake up for a few minutes or an hour, then drift back into a dreamlike state. Instead of worrying and trying to wake them up, forcing them to be active, try changing your perspective. This is how their body conserves energy for the most important final moments. This is a time for your loved one to gradually detach from the outside world and turn inward. Don't force activity. Be gently present. Forcing an elderly loved one to get up, go for a walk, or eat enough to gain strength may only cause more fatigue, even emotional harm. Instead, observe and respect their limits. Everyone has a different way of leaving, and no one can define what is right or wrong in these final days. What you can do is cherish those rare moments of clarity, even if it's just for a few minutes. 2. Share a beautiful memory with them. Gently hold their hand without words. Play their favorite music at a low volume. Look at them, smile, and expect nothing. Express love, gratitude, even apologize if needed. Such small moments can bring great comfort. Care is not about doing more. It's about understanding correctly. There's a gentle truth that's hard to accept. You cannot save your loved one from death, but you can help them leave in peace. End-of-life care is no longer about healing or making them better. It's about being present, empathizing, and creating final memories without regret. And sometimes, letting them sleep peacefully without trying to pull them back into this world is the deepest form of love. If your loved one is experiencing prolonged fatigue, don't worry that you're not doing enough. Perhaps you're doing exactly what they need. Silently sitting by their side, not forcing, not expecting, just love and presence. That's the final gift the living can give to the one who is gradually leaving. When a loved one withdraws emotionally and mentally. In the final months of life, many elderly individuals begin to experience profound changes in their mind and emotions. They become less talkative, seem less interested in the world around them, and sometimes no longer recognize their closest family members. This is not a sign of indifference or apathy. It is a natural part of the journey toward the end of life. A gentle and gradual withdrawal from reality. Why do they become less talkative and detached? You may notice that your loved one, once lively, humorous, and attentive to small details, now becomes quiet, indifferent, and less engaged in conversations. Even when you tell stories, ask questions, or try to create a joyful atmosphere, they only respond with distant looks or brief, indifferent remarks. This phenomenon is quite common in elderly individuals at the end of life. The brain and nervous system gradually slow down, and they tend to withdraw into the inner world, a place of quiet, minimal stimulation, and less noise. There is no longer a need for much conversation, and they spend most of their time resting, drifting, or simply lost in thought, even if those thoughts are not easily understood. Memory fluctuations, awake and dreaming. One of the most concerning changes for family members is the fluctuating memory and awareness. Sometimes they are unusually alert, recalling names, telling old stories, and even offering profound insights that surprise everyone. But just hours later, they may confuse dates, call family members by the wrong names, or ask questions they just answered. This is not simply a sign of a condition like dementia, but often a natural fluctuation of a brain that is gradually tiring. The body can no longer maintain continuous alertness. The moments of clarity mixed with states of confusion are how their mind is transitioning slowly and without urgency. Not recognizing loved ones. Don't be quick to feel sad. One day, you may enter the room and notice your loved one looks at you as if you were a stranger. They may not call you by name or look at you with a confused expression. For many, this is the most heartbreaking moment, realizing they are losing their last connection. However, remember that love does not fade, even as memory weakens. Even if they no longer react as before, deep in their subconscious, they still feel your presence. They may not call your name, but they still feel safe when you hold their hand, or peaceful when they hear your familiar voice. This is not forgetting. It is a form of withdrawal, like a child closing their eyes after a long day. Don't try to bring them back to reality. Many people, when seeing their parents or grandparents drifting away from reality, try to explain, remind, or even argue to help them wake up. Though these actions come from love, in reality, they only exhaust both parties more. In the final stages of life, reality is no longer important. The right date, remembering names, or understanding the story are no longer standards of life. What is needed most is a sense of emotional safety, feeling loved, and the presence of family beside them. Patience and gentleness are the most valuable gifts. You don't need to do much. Just be patient and stay by their side, not expecting them to understand you, recognize you, or respond the way they did before. Small actions like gently stroking their hair, sitting quietly and holding their hand without saying anything, smiling at them even if they don't smile back, saying, "I'm here," or "Don't worry, Mom." All these actions, no matter how small, carry immense soothing power. Emotional and mental withdrawal is not rejection of you, nor is it a sign of indifference. It is a very natural part of the final journey of a person, a journey that moves quietly, not hurriedly, but with great humanity. If you are witnessing your loved one drifting away from reality, understand that they are not going alone. They are going within the embrace, the love, and the peace that you bring each day, simply by remaining by their side. Emotional mood swings, when emotions become a burden. One of the most misunderstood signs in elderly people nearing the end of life is the frequent changes in mood and emotions. They may suddenly become irritable, anxious, depressed, or show signs of pessimism, even though they were once very optimistic. These behaviors are not merely a result of grumpiness due to old age. Rather, they can signal that the brain is struggling to process emotions and the world around them. Emotions are no longer stable as before. It is often assumed that as people age, they become calmer, more understanding, and more accepting of things. However, for those in the final stages of life, the reality is quite different. The aging of the brain and profound biological changes mean that they no longer have the ability to control their emotions as they once did. A simple comment can make them angry. A small change in their routine can cause them to become anxious to the point of sleeplessness. A casual glance can make them feel abandoned or deeply hurt. These reactions are not intentional, but are a result of a weakening brain no longer able to regulate, analyze, or suppress negative emotions as it once could. Why do they become irritable and sensitive? The brain acts as an emotional filter. In young and healthy individuals, when feelings of anger or sadness arise, the brain helps them recognize, assess, and respond appropriately. However, in elderly individuals with declining health, this filter no longer functions as effectively. They feel everything more intensely, but cannot express or explain it like they did before. They become easily irritated by sounds, lights, or even small changes in their environment. They feel uneasy because they have lost their sense of control, and their reactions become more extreme. It's not that they are becoming bad-tempered, but that they are scared, confused, and exhausted, and this is how they express it. Anxiety and depression, the silent shadow. In addition to irritability, many elderly individuals slip into constant anxiety or quiet depression. They may speak less, laugh less, or sigh for no reason. Some ask the same question repeatedly, express irrational fear, or suffer from chronic insomnia. This is not over-worrying, but a result of a mind that feels it is falling behind the world. They know their body is no longer the same. They feel they are becoming a burden. They fear the unspeakable, death, separation, and being forgotten. Look behind the anger. What is crying out? When a loved one raises their voice at you, you might feel hurt, but take a moment to pause and ask yourself, what do they need behind this anger? Maybe it's a sense of safety. Maybe they need reassurance that they are still loved, still not abandoned. Perhaps they don't know how to express this, so it comes out in harsh words. Be patient. Don't respond with anger. Instead, take a deep breath. Gently hold their hand. Ask, is there anything making you uncomfortable, Mom? Or, I'm here with you, Dad. You're not alone. These gentle words, though they may not erase all the anxiety, can soothe a lost heart. Emotional care is just as important as physical care. On the final journey of life, we often focus on medication, diet, and supportive devices. But emotions are just as crucial to health. An elderly person nearing the end of life is not only experiencing physical pain, they also carry with them a complex, contradictory range of emotions, many of which cannot be expressed. They need you to listen, even if you don't say anything. They need you to be there, even if you don't understand what they are thinking. And most importantly, they need to feel that. No matter how their mood changes, you will always love them unconditionally. When an elderly loved one's mood swings, it is not a loss of control, but a quiet exhaustion of the brain and soul. The anger, anxiety, or sadness they display should not be judged, but understood with empathy and deep love. Because in the final days of life, what matters most is not controlling everything, but having someone there, patient, gentle, and never leaving. When emotions become waves, the emotional mood swings in the elderly at the end of life. One day, they are cheerful and alert. The next, they are irritable over trivial matters, refusing to talk, and unusually anxious. This emotional instability can leave many loved ones feeling confused, even hurt. However, it's important to remember, this is not their true personality, nor is it intentional. It's how their brain is struggling to adapt to the weakening of both their body and mind in the final stages of life. No longer the same person, but a weary version of themselves. As people age, especially when the body starts to prepare for the end, the brain also suffers significant impacts. The areas of the brain responsible for controlling emotions, regulating behavior, and processing external stimuli gradually lose their effectiveness. As a result, things they could once brush off now trigger strong reactions. A sudden sound may cause them to panic. A change in routine can make them irritable. A gentle reminder might be misunderstood as criticism. Mood swings, from anger and anxiety to depression, are direct consequences of a brain no longer able to regulate complex emotions effectively. Not intentional, but no longer in control. From an outsider's perspective, an elderly person who raises their voice, becomes upset, or turns negative might be seen as difficult or uncooperative. However, if we look deeper, we will realize this is simply an outward manifestation of a mind that is weakening. Like an overloaded computer, their brain can no longer process the flood of information and emotions. When triggered by sounds, words, lights, or even old memories, they can no longer calm themselves as they once did. Thus, strong reactions are often the only way left to cope, even if this hurts those around them. Anxiety and depression, silent companions. Mood swings aren't always expressed through anger. Many elderly individuals become quiet, withdrawn, and less communicative. They may sit for hours without reacting, smiling, or showing any joy, and sometimes appear sad without clear reasons. This is a sign of depression in the elderly, a psychological state that is not uncommon but often overlooked because it can be mistaken for the moods of old age. Additionally, anxiety is often present. They may repeatedly ask the same question even though it's been answered. They worry excessively over small matters. They may sigh often, complain, or suffer from sleepless nights. All these are signals that their brain is exhausted, unable to handle the complex emotions as it once could. The loved ones must be the root of peace. In the final stages of life, elderly individuals don't need us to fix their emotions. Instead, they need a safe space where they can be themselves, even if that self is a weaker, more anxious, and vulnerable version than before. When they become irritable, listen calmly, without responding with anger. When they are anxious, gently reassure them, even if it means repeating the reassurance many times. When they are sad, simply be there with them, even if you can't make them feel better immediately. Patience is not easy, especially when you are exhausted. But each time you choose to love instead of reacting, you create a peaceful space, the most valuable thing for them at this time. Mood swings, a sign of a transition. Mood changes are not bad. Rather, they represent a final language they use to express that they are in a transition, gradually leaving the familiar world. As they approach the end, it becomes harder for them to control what is happening inside, both physically and mentally. Understanding this will make it easier for you to let go of expectations that they must be calm, optimistic, or rational as they once were. Instead, you will learn to accept, accompany, and love them in the way they need, not the way you wish. Mood swings are not temperament. They are signs of a weary mind and a body that is gradually withdrawing. Be patient, be loving, because sometimes what they need most is not advice, but a gentle gaze, a hand to hold, and a heart that does not judge. When the immune system becomes fragile, signs the body can no longer fight back. In the final stages of life, the elderly not only experience physical decline, but also witness a significant weakening of the immune system, the body's silent defense mechanism. This is one of the most important signs, yet it is often overlooked or mistaken for a simple cold or the fatigue that comes with aging. However, if we look closely, immune system deterioration is not just a sign of illness, it's a manifestation of a body gradually letting go in the journey of life, aging, illness, and death. Mild but persistent illness, when the body can't fight back. Previously, a cold could be cured in a few days with rest. But for the elderly, seemingly minor illnesses like coughs, colds, or skin infections can persist for weeks, even months. Despite treatment with medication or rest, the condition often doesn't improve significantly. Moreover, even small wounds take longer to heal, and they are more prone to infections. A minor scratch on the leg might take weeks to heal and can quickly become infected if not carefully attended to. This happens because white blood cell count drops, reducing the ability to detect and destroy bacteria. Blood circulation weakens, preventing nutrients from reaching the injured area. Cell repair mechanisms slow down, causing wounds to heal slowly. Silent infections, no fever, no pain, but extreme fatigue. A particularly dangerous characteristic of older adults is that signs of infection are often unclear. Instead of a high fever, pain, or swelling, they might only feel fatigued, slightly confused, or low in energy. This is what's known as latent infection, often occurring in urinary tract infection, lungs, mild pneumonia, skin, cellulitis. This can lead caregivers or medical staff to mistake it for simple fatigue due to aging or mild forgetfulness. In reality, the body is struggling to fight off an infection, but no longer has the strength to signal it clearly. Antibiotics, a lifeline or just a temporary solution? When conditions don't improve, antibiotics are often used. However, in the elderly with weakened immune systems, antibiotics are not as effective as they once were. Reasons include reduced ability to absorb medication due to liver and kidney dysfunction, antibiotic resistance due to repeated use in the past, weakened immune system. Even if bacteria are killed, the body cannot fully recover. Antibiotics, instead of being a complete solution, now only help delay the progression of the infection, but they cannot fully restore health. This is when caregivers need to ask, are we trying to heal or are we just trying to prolong? Instead of fighting, offer gentle care. When the immune system becomes too weak, the focus should no longer be on eradicating all bacteria, but on making the loved one as comfortable as possible. Simple yet meaningful actions include maintaining good personal hygiene, reducing the risk of skin, oral, and urinary infections, creating a clean, fresh environment, limiting the growth of mold and bacteria, providing light, easily digestible food and water, supporting what little immune function remains. Monitoring small changes, whether it's unusual fatigue or slight confusion, treat them as important signals. Watching a loved one become increasingly frail, susceptible to illness, and easily infected can leave us feeling helpless. But understanding that this is not anyone's fault, but rather a natural part of the final stages of life, will allow us to let go of fear and instead be fully present with them. A weakened immune system is not only a medical sign, but also the final whisper of the body. I've fought long enough, and now I need to rest. As the immune system begins to decline, your loved one is no longer a warrior who can bounce back after every illness. They are entering a stage where they need gentleness, care, and loving presence more than intense medical intervention. Caregiving is not about holding on at all costs. It's about making the final journey gentle, peaceful, and filled with compassion. Messages behind the silent signs. When an elderly loved one starts showing small but unusual changes, unexplained weight loss, sleeping more than usual, memory lapses, or frequent minor illnesses, it's easy for us to feel anxious and try to fix everything. The desire to keep our loved ones with us is completely natural. However, sometimes this effort can lead to exhaustion, stress, and heartache for both the patient and the caregiver. In reality, these signs are not meant to cause fear or despair. They are gentle reminders from the body that it's time to transition from fighting to acceptance, from the effort to hold on to offering peace. Recognizing these signs early helps you prepare mentally and emotionally, giving you the opportunity to provide better care and, most importantly, allowing time to create meaningful final moments. These could be peaceful afternoons holding hands, slow conversations, or simply your gentle presence beside your loved one. It's not always necessary to do one more thing to save them. Sometimes simply being present with love is enough. This is not surrender. It is a deeply humane choice, allowing the person you love to leave in peace, without pain, without fear, and knowing they were fully loved until the last moment. Signs before it's too late, and when to let go. Caring for an elderly loved one often brings subtle changes that aren't easy to spot. Sometimes the slow changes in the body make the first signs of health issues easy to overlook. It's important to understand that not all signs of illness are immediately apparent, especially with older adults. One common issue you should be aware of is infections. Infections without clear symptoms. As we age, the body doesn't respond to infections as vigorously as it did when we were younger. One of the signs you may notice is no fever, even when the body is fighting off an infection. Instead of presenting with high body temperature, older individuals may appear confused, forgetful, or even experience a state of mental fog without understanding why. Another common symptom when an infection occurs is loss of appetite or dehydration. They might not feel hungry or interested in eating, even though they previously had a normal appetite. These signs often don't come with clear pain, but they can significantly deteriorate their health, which makes it difficult for caregivers to identify the issue since everything happens quietly. Extreme fatigue and social withdrawal. Another significant sign is extreme fatigue. The elderly may feel exhausted and unable to engage in their usual activities, even after getting enough rest. This fatigue isn't just physical. It may signal the body's struggle against an infection or a serious underlying issue that it cannot recover from quickly. You may also notice social withdrawal. A loved one may stop interacting with friends or family or shy away from social activities they used to enjoy. This is a clear sign that their health is deteriorating and they may no longer feel energetic or motivated to participate in conversations or events. This change could stem from fatigue, lack of energy, or simply the feeling that they don't have the strength to engage in those activities anymore. Wounds that heal slowly. A warning sign. Another sign to pay attention to is slow healing wounds. Whether large or small, wounds in elderly individuals generally take longer to heal. If a wound persists without healing or shows signs of infection, such as redness, swelling, or pus that doesn't improve after some time, this is a concern. It could indicate a weakened immune system or that their body is no longer able to heal as efficiently as it once did. In some cases, delayed wound healing may also be related to poor circulation, nutritional deficiencies, or other health problems. Don't ignore this sign, as it could be a sign that your loved one's overall health is deteriorating and that prompt medical intervention is needed. When to let go and focus on loving care. All of these signs can be worrying, and you may feel unsure of what to do. However, it's important to know when to let go and change your approach. Sometimes, fixing everything isn't the most important thing, but rather ensuring that your loved one's final days are filled with peace, comfort, and love. When you notice these signs, the first thing you should do is consult with a doctor to better understand the health condition of your loved one. However, in addition to seeking treatment options, you should also take time to create meaningful moments that make them feel loved and not alone. When the time comes, learn to let go and focus on creating peaceful, love-filled moments instead of racing against time to try and fix everything. Life in its final stages cannot always be prolonged indefinitely, but the beautiful memories, the moments of peace, and the loving care you provide will be an invaluable gift for your loved one. When to stop treatment and focus on comfort. Caring for a loved one in their final days is one of the most challenging experiences anyone can face. During this time, there will be moments when we have to make a heart-wrenching but necessary decision: when to stop active treatment and instead focus on end-of-life care, helping them spend their remaining days in comfort and peace. There comes a time when medicine can no longer save. In many cases, medication and treatments no longer have the effect they once did. When your loved one's condition reaches a critical stage, treatment may only serve to prolong life without alleviating pain, or may even cause additional side effects. Medications and therapies may no longer prevent the progression of the illness and instead contribute to physical suffering. In such situations, your loved one may endure persistent pain, fatigue, and sometimes even difficulty breathing, coughing, or changes in mental state, which can make them more uncomfortable than ever. When treatments are no longer effective and recovery is impossible, continuing medical interventions may only tire the body further, sometimes causing unnecessary pain. At this point, shifting from curing the disease to end-of-life care is not just a practical decision, but a compassionate way to ease suffering and improve quality of life during their final days. Making the decision to transition from curing to end-of-life care. This decision is never easy. It requires courage, patience, and sometimes even self-awareness of the current reality. When your loved one is in the final stages of life and treatments no longer offer any improvement, transitioning to end-of-life care provides a greater sense of peace, allowing them to experience their remaining time in the gentlest and most fulfilling way possible. End-of-life care doesn't mean giving up or surrendering. On the contrary, it means focusing on comfort, helping your loved one feel loved, safe, and free from further pain. Rather than racing against time to cure them, you can focus on providing a peaceful environment where they can rest and find tranquility in their final moments. Doctors often don't say this. One thing many families may not realize is that doctors often do not directly bring up the idea of stopping treatment and transitioning to end-of-life care, even though it's an important and reasonable decision in many cases. Doctors will always try to offer the best possible treatment, but in many instances, they also understand that there comes a point when further treatment is futile, and continuing only prolongs unnecessary suffering. In fact, stopping active treatment and transitioning to end-of-life care can provide a more peaceful and humane passing. Your loved one won't have to endure unnecessary pain, and instead, they can spend their remaining time surrounded by the love and care of family. When to stop treatment and focus on comfort. When faced with this difficult decision, there are several signs that can help you recognize the right moment to transition from active treatment to end-of-life care. 1. No progress in treatment. If your loved one shows no signs of recovery and their health continues to decline despite treatment, this may be the time to transition to end-of-life care. 2. Uncontrollable pain. If your loved one is suffering from chronic pain that cannot be relieved by medication, stopping treatment to focus on pain management and improving quality of life may be a better choice. 3. Mental decline. If your loved one has lost cognitive function or is experiencing confusion, creating a peaceful and comfortable space for them, rather than continuing treatment, will help them live out their final days more comfortably. 4. Inability to care for themselves. If your loved one can no longer care for themselves and depends entirely on others for assistance, shifting to end-of-life care will spare them from complex medical procedures and allow them to rest. End-of-life care brings peace. Ultimately, remember that end-of-life care is not about giving up. It's about helping your loved one pass away peacefully and without unnecessary suffering. By transitioning from active treatment to end-of-life care, you can create a space of love and warmth for them in their final days. This approach allows them to feel loved, cared for, and free from the pain of additional medical interventions. This decision can be incredibly hard, but remember that comfort and peace at the end of life is a beautiful gift you can offer to your loved one. Instead of prolonging life, prioritize peace. 5 ways to support comfort when a loved one is frail. In the final days of life, one of the hardest decisions families face is to stop active treatment and transition to end-of-life care, where a loved one no longer has to endure pain and can spend their remaining time in peace. Instead of futilely attempting to extend life, focusing on comfort and safety can be a beautiful gift of love during the precious final days. Here are 5 ways to provide comfort for a loved one when they are frail, ensuring they feel cared for, loved, and at peace in their final moments. 1. Maintain hydration. Avoid dehydration. Weakening the body. One of the most important aspects of end-of-life care is ensuring the body remains adequately hydrated. Dehydration can worsen the body's condition, leading to serious issues like low blood pressure, fatigue, and reduced organ function. Especially in the final days, the body may no longer feel thirsty or desire food, but maintaining proper hydration is essential to prevent severe dehydration. Water can be provided through various methods, such as drinking, thin soups, or even through an IV, depending on the person's condition. This helps improve alertness, reduces fatigue, and supports essential bodily functions. 2. Skincare to prevent bed sores. In the final stages of life, a loved one may be unable to move much, leading to pressure sores or bed sores. This is a common issue for bedridden patients. To prevent this, it's important to regularly change their position and support their body with care. Keeping their skin dry and clean is crucial to prevent sores. Using gentle skincare products, moisturizing lotions, or protective gels can help protect the skin from dryness and cracking. 3. Natural pain relief. Using warm compresses, massage, and essential oils. Pain relief during the final days doesn't only rely on medication. You can also employ natural pain relief methods. Warm compresses, gentle massage, and the use of essential oils are simple yet effective ways to make your loved one feel more comfortable. Applying warm compresses to tense or sore areas can soothe pain and help the body relax. Gentle massage improves circulation, reduces muscle tension, and creates a sense of relaxation. Essential oils like lavender, peppermint, and orange can relieve pain, calm the mind, and help your loved one feel at peace. 4. Create a quiet, familiar space. Better than a cold hospital room. A crucial element in end-of-life care is creating a calm, familiar environment where your loved one feels safe and comfortable. Moving them from the cold, impersonal hospital environment to a place they know can bring much-needed peace. If possible, arrange care at home, where they can rest in a familiar room with cherished belongings, soft music, and warm lighting. This helps reduce stress and anxiety, making them feel more comfortable and connected to their surroundings in their final moments. Respect the patient's wishes. Do they want continued treatment or peace? One of the most important aspects of end-of-life care is respecting the patient's wishes. They may have specific desires about continuing treatment or resting peacefully. Sometimes a patient may not want to endure further painful treatments and may simply want to rest. Listening to and understanding their wishes is the best way to ensure they experience peace and respect during their final days. If the loved one can communicate, ask them about their preferences regarding treatment or care. If they can't communicate, consult the doctor about their condition to make an informed decision. End-of-life care is not about giving up, but about loving in the right way, ensuring your loved one passes peacefully without additional suffering. End-of-life care, an act of love. End-of-life care is not about giving up, but about loving in the right way, helping your loved one feel the love, care, and peace they deserve in their final days. Instead of trying to prolong life unnecessarily, focusing on comfort and making them feel loved is the best way to ensure they experience their final moments fully and peacefully. Changes in breathing. Final signs. In the final stages of life, one of the clearest signs that a loved one is nearing the end is a change in breathing. These changes may not always be immediately obvious, but when they do occur, they can be part of the natural process the body goes through as it prepares for the final stage. The person's breathing will change, and this is an important sign that their body is getting ready to let go. Our slow and interrupted breathing. One of the first signs of a change in breathing is slow and interrupted breathing. The person may breathe slowly and stop breathing for a few seconds, sometimes up to 30 seconds. This is a normal phenomenon when the body is nearing the end of life. As the body no longer has the strength to maintain regular breathing, the mechanisms that regulate respiration gradually diminish, causing the breathing to become irregular, sometimes alarming to those around. However, this is not a sign of pain or discomfort, but rather part of the natural process when the body is preparing for its departure. While it can be difficult to witness, this is a clear sign that the body is starting to let go and is nearing the end of its journey. Irregular breathing, deep breaths, stop, then deep again. When the body enters its final stage, a distinct respiratory phenomenon called Cheyne-Stokes breathing may occur. This irregular breathing pattern involves deep breaths, followed by a sudden pause for a few seconds before resuming deep breaths. This cycle may repeat multiple times within a short period. Although this can make family members feel anxious, it is a natural response of the body as physiological functions decline. Cheyne-Stokes breathing often happens in the final stage of illness, especially when the body no longer has the energy to maintain regular respiration. It's important to remain calm and not let this change cause panic. Sometimes this change lasts only a few hours or days, and the body moves closer to its peaceful end. Mouth breathing with gurgling sounds. Another sign of a change in breathing is mouth breathing, accompanied by gurgling or moaning sounds. This occurs when the body can no longer control breathing normally, and fluids may accumulate in the throat. These sounds are often not signs of pain, but rather a natural response of the body during the final stages of life. Although the gurgling sounds may cause concern for loved ones, there is no need to panic. This is part of the physiological process as the body prepares to depart. These changes in breathing are normal during the final days of life and may signal that the body is completing the process of resting for the last time. A touching story. The stories of loved ones in their final moments are beautiful testaments to love and companionship. Eleanor passed away in the loving arms of her family, holding hands and surrounded by whispered words of love. When loved ones are present, these final moments become warm and meaningful. Chris, a son, heard his mother's final words, "I love you," before she peacefully passed away. It was a loving farewell, one of the unforgettable moments of his life. Meanwhile, David quietly slowed his breathing and passed away in the arms of his wife. There were no tears, no struggle, just a gentle, peaceful moment when the body was ready to let go and find its final rest. The final moments, an opportunity to share love. These signs of respiratory changes are not just physiological signs, but also an opportunity for loved ones to show care and affection. These changes are not something to fear, but rather a part of the natural process of life. Instead of worrying about the changes in breathing, take the time to be with your loved one, hold their hand, and share words of love. These are precious moments that can bring peace to both the person passing and those who remain. Respiratory changes, while they may seem concerning, are in fact a part of the natural process as the body prepares for departure. Each sign, from slow, interrupted breathing to gentle gurgling sounds, are messages from the body signaling the end is near. Embrace them calmly so you can care for your loved one with all the love you have, helping them depart in the most peaceful and serene way possible. How to comfort a loved one in their final moments. As a loved one approaches the end of their life, the most important thing we can do is to provide them with comfort and peace. Instead of focusing on the sadness of their departure, we can concentrate on creating a calm, loving environment that helps them leave in tranquility. Here are some things you can do to support your loved one during these final moments. 1. Prop up pillows for easier breathing. When your loved one no longer has the strength to breathe normally, placing a soft pillow behind their back can help raise their head and neck, making it easier for them to breathe. Sometimes, a gentle lift of the head can alleviate shortness of breath and provide comfort. This simple yet effective action can greatly improve their comfort during the final stages of life. If possible, adjust the pillows to ensure they are at the most comfortable angle, avoiding any strain while breathing. Physical comfort helps them feel the tenderness of those last moments. 2. Maintain cool and humid air. One of the key factors in creating a peaceful environment for your loved one is ensuring the air remains cool and humid. As the body weakens, your loved one may feel discomfort if the surrounding environment is too hot or dry. Adjusting the room temperature for optimal comfort is essential. Using a humidifier to maintain moisture in the air can help reduce dry mouth or throat, especially when they are no longer able to drink water regularly. This will help your loved one feel more relaxed and alleviate any discomfort they may be experiencing in their final days. Hap 3. Offer small sips of water or ice chips. During the final stages of life, many patients find it difficult to drink water easily and may experience dry mouth or throat. Instead of forcing them to drink large amounts of water, offer small sips or let them suck on small ice chips to help moisten the throat and reduce dryness. Water or ice can also help loosen mucus, making it easier for them to breathe and reducing discomfort. Be patient and gentle while offering these fluids. Sometimes your loved one may not want to drink, and that is normal during this stage. Just offer water when they are able to accept it and don't force it if they don't want it. Nat 4. Stay calm when they stop breathing for a few seconds. A common sign in the final stages is that the person may stop breathing for a few seconds. This can be alarming, but it is actually a natural response of the body. As the body loses its ability to sustain life, breathing may become irregular and sometimes pause briefly. In these moments, instead of panicking, try to stay calm. The important thing is not to make your loved one feel stressed or anxious. Remember that pausing for a few seconds is not a sign of pain, but simply part of the physiological process as the body prepares to let go. 5. Don't force oxygen. Consult the doctor. When a loved one is nearing the end, using oxygen may not always be necessary, and in some cases, it may not help much. Before deciding to administer oxygen, it's important to consult with a doctor about the patient's condition. The doctor will evaluate whether oxygen therapy truly improves the patient's quality of life. In many cases, administering oxygen can increase the patient's stress and may not provide significant benefits. Remember, the goal is to ensure your loved one's comfort, and sometimes avoiding medical equipment may be the best choice in the final stages. 6. Be present and gentle, holding hands, whispering sweet words. One of the most precious things you can do for your loved one in their final moments is to be present with them, offering all your love and care. A gentle handhold, a comforting whisper, or simply your presence can bring them peace in a way that words cannot express. Gentleness and patience are key when caring for the dying. Don't worry too much about what needs to be done. Instead, focus on creating a peaceful, loving atmosphere. Sometimes, quiet moments together without many words are the most meaningful and fulfilling. Helping a loved one pass peacefully is not easy, but it can offer them tranquility in their final moments. By providing thoughtful, loving care, you can help your loved one feel more comfortable, reduce anxiety and pain, and ensure they leave this world peacefully. Always remember, small acts like holding a hand, whispering a word of comfort, or simply being present can be the greatest source of solace for your loved one during their final moments. The most precious thing is being present. In the final moments of a person's life, the most important thing you can do is not to seek treatments or prolong their life, but to simply be present. These moments will remain in your memory and in the memory of your loved one. What you do during this time, even the smallest actions, will leave a lasting and meaningful mark that transcends time. Presence is a priceless spiritual gift. In the final stages of life, the body and mind may no longer function as before. At this point, medical treatments and machines may no longer be effective, and what's truly valuable is your presence. Your loved one doesn't need to endure treatments or devices. They simply need to feel your care and love. A gentle handhold, a comforting pat, or just being beside them can bring them peace. Don't feel pressure to do something grand. Your listening ear, your understanding, and your presence will have a greater impact than any treatment could. 2. Express words of love. Sometimes we forget the importance of expressing love. When time becomes short, showing love becomes incredibly important. Don't wait until it's too late to say the things you want to share. Words of love, gratitude, or encouragement can bring warmth and comfort to the person who is ill. Tell your loved one what you haven't said before, even if it's something simple like, "I love you, Mom," "Thank you, Dad," for everything, or "We've shared some beautiful moments together." These words will not only bring them peace in their final moments, but will also allow you to release your own emotions, so you won't regret not having said them later. Not 3. Recall memories. Sharing stories and memories from throughout your lives will help your loved one feel connected and at peace. Recall joyful moments, trips, and happy family times that you've shared together. These stories will not only make your loved one feel more at ease, but will also reconnect you to them once more. Telling these memories reminds the person about the beautiful and bright moments in life, soothing any worries or fears they may be experiencing. It helps them feel loved and cared for, even as their body weakens. 4. Don't wait until it's too late. Many of us delay expressing our feelings because we think there's still plenty of time. However, time is something no one can control. We never know when someone's final moment will come, which is why we should never wait too long to express love or share our deepest thoughts. Every moment spent with a loved one in their final days is precious. You can't change the past, but you can create meaningful memories in the present. Don't let unspoken words or unfinished actions linger in your heart when they're no longer here. Your presence, your words of love, and your shared stories will become everlasting imprints. 5. Feel the peace and silence. In addition to expressing love and affection, presence also means patience, listening, and creating a peaceful space. In the final hours, your loved one may no longer have the strength to speak, but they can still feel the peace and warmth you bring. Create a comfortable and quiet environment, avoiding making the person feel tense or anxious. Sometimes simply sitting beside them, holding their hand, and staying silent is enough for them to feel your love and care. 6. Be their companion on their final journey. Your presence in these final moments is not just a physical act, but a psychological companionship. Your loved one will not feel alone, and this support gives them strength as they step into their final journey. You've been there through the ups and downs of life, and now you will be there as they move into eternity. These final moments are not for us to mourn or regret. Instead, they are a time to honor life, cherish memories, and celebrate the love shared between you and your loved one. Don't wait until it's too late to say the things you need to say. The most precious thing you can do in your loved one's final moments is to be present, offering all your love and tenderness. These seemingly small acts can provide comfort and peace to the person as they transition. Don't let unspoken words or unshared memories become sources of regret later. Your presence is the greatest gift they can receive in their final moments of life. What have you learned from elderly loved ones about life and love? Everyone carries valuable lessons from the older generations. The moments spent with the elderly can teach us patience, unconditional love, and the importance of appreciating the simple things. Share your thoughts in the comments to spread these values and create a space of support and empathy for each other in life.